Electromyography, or EMG, is a fascinating window into the world of our muscles. By listening to the electrical whispers of our muscles, EMG helps diagnose a wide range of neuromuscular disorders. Imagine being able to eavesdrop on the conversations between your nerves and muscles. It's like using a high-tech microphone to amplify the subtle electrical signals that muscles generate when they contract and relax. This information can be the key to understanding and treating conditions that affect our ability to move, speak, and even breathe. EMG isn't just about diagnosis. It also plays a crucial role in rehabilitation. By providing feedback on muscle activity, EMG helps patients regain control of their movements and track their progress during therapy. Before embarking on your EMG journey, there are a few simple but important preparation steps. The goal is to ensure the most accurate readings possible from your muscles. The first step typically involves gently cleansing the skin over the muscles being examined. This removes any oils or lotions that might interfere with the electrode's ability to pick up those subtle muscle signals. Next comes the placement of electrodes, the stars of the show when it comes to EMG. These small, sensitive sensors act as the bridge between your muscles and the EMG machine, capturing the electrical whispers of your muscles and converting them into signals that the machine can understand. There are two main types of electrodes used in EMG: surface electrodes and needle electrodes. Each type has its own strengths, depending on the specific information the doctor needs. Surface electrodes sit comfortably on the surface of the skin. They are like small, flat discs that adhere gently to the skin. These are typically used when examining larger muscles or when a broader picture of muscle activity is needed. Needle electrodes, on the other hand, are used to delve deeper, literally. These involve a very thin needle that is inserted directly into the muscle. These needle electrodes are particularly useful when a more precise examination of a specific muscle is required. Now, let's talk about how the electrical activity of muscles is actually recorded during an EMG. Muscles, even when at rest, produce a very faint electrical signal. When a muscle contracts, even slightly, this electrical activity changes. During an EMG, you might be asked to contract the muscle very gently, then gradually increase the force of contraction. As the muscle contracts with more force, the electrical signals become stronger and more frequent. This dynamic range of electrical activity provides valuable information about the health of the muscle and its nerve supply. The EMG machine faithfully records all these changes, capturing the subtle nuances of your muscles' electrical conversations. It's like listening to a symphony of electrical impulses, each telling a story about the state of your muscles and nerves. The electrical signals picked up by the electrodes are displayed on a screen, often as wavy lines that ebb and flow with the muscle's activity. These aren't just random scribbles. They're the visual representation of your muscle's electrical language, a language that trained specialists can read and interpret. These specialists analyze the shape, size, and frequency of these waves. They look for patterns, both normal and abnormal, that can provide clues about the underlying condition. For example, certain wave patterns might indicate muscle fatigue, while others could suggest nerve damage. Think of it like deciphering a secret code. Only those with the right training and expertise can unlock the valuable information hidden within the intricate patterns of muscle activity. The ultimate goal of EMG is to determine whether your muscle and nerve activity falls within the realm of normal, or if there are any red flags that suggest an underlying problem. Normal EMG results are like a clean bill of health for your muscles and nerves. They indicate that the electrical activity is within the expected range, suggesting that the nerves are communicating effectively with the muscles. Abnormal EMG results, on the other hand, are like puzzle pieces that help doctors piece together a diagnosis. These abnormalities can manifest in a variety of ways, each with its own set of potential implications. For instance, spontaneous electrical activity when the muscle is at rest could suggest a problem with the nerve supplying the muscle. On the other hand, decreased electrical activity during a muscle contraction might indicate a problem with the muscle itself. Doctors consider your medical history, physical examination, and other diagnostic tests to paint a complete picture of your condition. EMG, with its ability to delve into the intricate world of muscle and nerve communication, has a wide range of applications in medicine. It's a versatile tool used for everything from diagnosing complex neuromuscular disorders to aiding in the rehabilitation of patients recovering from injuries. Conditions like amyotrophic lateral sclerosis, muscular dystrophy, and carpal tunnel syndrome can all be diagnosed with the help of EMG. By analyzing the electrical activity of muscles, doctors can pinpoint the location and extent of nerve or muscle damage. Beyond diagnosis, EMG plays a crucial role in rehabilitation. Physical therapists use EMG to provide patients with real-time feedback on their muscle activity during exercises. This biofeedback helps patients regain control of their muscles, improve muscle strength, and prevent muscle atrophy.